Hello, everyone. Another edition of Set It Straight with Doc Bots. My name is Todd Bavona with Gotham Trinity Productions. I'm your host, and your co-host today, of course, is Michael Graziuso, my partner at Gotham Trinity. And we're just having general conversations about COVID-19 or coronavirus throughout the weeks and coming up, because there's a lot of information out there, Mike, right? So we're trying to sift through it a little bit, just have light discussions about what we're hearing, what we think, what we know. For instance, testing. Testing right now, there have been pop-up testing locations. There have been first responders.
There have been scam pop-up testing locations. Have you seen that?
I haven't seen
like fake. So in some countries they've been fake pop-up testing locations, like come to get tested for it, and people are lining up for it. I mean, how do you know? It's like people just want to get tested. They want to know if they're safe, and right. I think that's the biggest thing. Once I feel that people can get tested and they have access to more tests, like a take-home, model, then, people could do what they need to do. They know that they're not infected, and people that are could definitely stay home.
And then issue with the testing though, right, Mike, is I think I had something like this in early February. My wife definitely had it. She had a couple of days where bedridden, fever, coughing, and she went to urgent care and they didn't find anything. They said it was a virus, but they couldn't indicate exactly what it was. It wasn't flu, it wasn't a cold. They didn't say upper respiratory infection. So that's another aspect. Is you can't, right now you can't test for someone who might have had symptoms. Like that's another side of this.
It's like, why is it so hard to test though? Can't you just give blood or blow your nose into a nap? I don't know. Like, why is it so hard to to test?
Provide a saliva sample. I don't know what there's got to be some, in layman's terms, there's got to be some more straightforward, streamlined way that mass people can do a testing, but it just seems to be so much more complicated. So let's set it straight with Dr. Thomas Bottiglieri from New York Presbyterian Hospital. So I know he's been hearing a lot of this. He's hearing us talk. Doc, what do you think about what we're saying in regards to testing specifically, and anything from people who think they might have had it to the current testing that they have now, and the prevalence of even false testing that Mike brought up?
Yeah, these are good points. The test is not a perfect test right now. The test that's widely being used is the test that's looking directly for virus, the actual virus RNA, and it's a PCR test where they're spinning down the viral components to separate out the proteins to prove that there's a virus there. So there is a false negative. False negative meaning if you swab and you don't have virus and you actually are sick, it's misleading, right? So the number of negative tests right now are certainly a misleading representation of how many people are infected. But I hear everybody in the community saying similar things to what you're saying, Todd, that they think they had it or somebody that they care about had it. And they talk about this, sickness that was ill-defined, and their doctor just told them to rest and drink fluids. And everybody kind of wants that reassurance to know that their immune system has been exposed and they're on the other side of it, right? But I don't know that that's a reliable indicator either, right? So there are other viruses. Think about it. We call this a flu-like illness, right? So this virus represents itself in a way that seems very similar to other viruses. So until we have an antibody test, we're just not going to know. And I think that's what Mike was talking about, right? You were talking about spin and blood.
Right.
That test is not ready for prime time yet. We're just starting to roll that out in some major medical systems like the Mayo Clinic and Stanford and other places in the city like our hospital. But we're not quite there where we're going to have that antibody test.
So that's going to be my follow-up question. Is obviously there's people are raising tons of money. Just read about the guy from Twitter is contributing $1 billion. 28% of his wealth to the cause. And Doc, what does that mean? Where is it going? I mean, obviously you don't know specifically where his money's going, but I feel like it's going for research. So what does that mean? I mean, who like the Mayo Clinic, you say, who else is getting this money to try and figure out this cure? One, and then two, time-wise. I mean, how long does it normally take? And when people say we got to expedite this, is that even possible? It's like, hey guys, hurry up. Like, no, this is science. You can't hurry science. And we don't just go on feeling. We need facts. We need research. It's science. So the two-part question, Doc.
Yeah, I think we'll talk about cure another time, but for staying on the point of testing at the moment, where does that money go? So we have an NIH, the National Institutes of Health, which is where our tax dollars get funneled into scientific pursuits. So that's a major source of where scientists get money to investigate things. There are huge collaborations going on all over the world right now, where universities like Columbia are bringing in other information from outside sources and sharing their information with others so that we can expedite the cure. So when you say, well, how do you expedite science? You expedite science by leaving the proprietary stuff behind and then collaborating, bringing together what we know. This idea of proprietary information, that's what companies use to develop patents and develop ways of marketing something. But in a time like this, when the world comes together and says, all right, this is more important than dollars and cents, which is exactly what's happening, those dollars get funneled to big research institutions, and those research institutions figure out how to bring together scientists from all over the world to share information and then push this idea forward of which test do we need, which antibodies are important, and how can we roll that out quickly so that everybody has access.
How difficult is it going to be once there is a testing out to roll out a kit, an at-home kit that is, it just sounds like a huge task, right, Doc? I mean,
well, yeah, doctors themselves sometimes, or nurses that are performing this test aren't performing it perfectly. I think we talked about in the last episode this idea of how you swab. So I don't know about a take-home test. It's not as simple as swabbing the inside of your cheek and sending out the DNA. For a blood sample, you have to actually do a venipuncture. So I think more realistically, what's going to happen is people are going to be presenting to their primary care doctors. They're going to go to the Quest labs or the LabCorp or the hospital testing center. They're going to get a blood sample, and they're going to get an answer in a day or two on what the antibodies that are present are actually in relation to two things: IgM, IgG. IgM is a protein that recognizes the virus early. IgG finds it late, and that can tell you where you are in the infection. Is this an early infection or have you resolved?
Okay. All right.
So you're saying they shouldn't trust like anybody saying that they have a take-home test and start or just a random pop-up.
There's a ton of no, Mike. There's a ton of marketing out there, and there's a lot of shenanigans. So I think you got to trust the people and the organizations that have proven themselves in the past. Your doctor, your hospital, present to those people that are in the know, and be very cautious of these mail-away kits because, Lord knows what the heck is going on out there. We saw that with masks, all these different kinds of masks being funneled in that were not really up to the standard, the NIOSH standard for hospitals, and that's still happening, right? So we have to be very cautious about where we get our stuff and where we're mailing away.
Wow.
All right. I mean, I think, Doc, anything else regarding testing that you feel the public should know? I don't have any more questions. If Mike, I think we're good, Doc.
The only thing I would say is people want to be tested because they want reassurance. There is no reassurance if you're not symptomatic, right? If you're not symptomatic, it's impossible to know with a test whether you've been exposed or not, whether you're before, during, or after active infection. Because remember, the infection presents in so many different ways, very mild all the way up to very severe. So don't run out for these nasal swab tests. It's not going to help anybody for you to say, okay, I've been exposed. We're all exposed. If you're symptomatic and you have risk factors, diabetes, hypertension, obesity, you're over 50 years old, these are big risk factors, and we may need to know because that helps us delegate care. But everybody wants to be tested, but you're not getting any reassurance if you have a negative test. I have friends who've had 2 or 3 tests already that were negative. What does that tell us? It tells us nothing.
Right.
So I think, follow the regulations right now. Stay at home. If you're symptomatic, get in touch. And one more thing, there's telehealth at basically every major medical institution. We're doing it. Every hospital is doing it. You can get on the phone, talk to a doctor, and get direct medical advice. This isn't really medical advice. This is just 3 guys talking about ideas. If you need medical advice, if you're not sure, get on a telehealth visit.
That's a great shout. It's just talk to your physician, start there, and then if they'll advise you accordingly. And if there's one thing, a lot of doctors can't have office hours now, so that everyone's on their phones and they're readily available to you. So, Doc, thanks so much as always. Good chat about the testing system. Appreciate you all joining us, and we'll see you on the next episode of Set It Straight with Doc Botts.